Everybody, we're doing a tour of the bone markings. So here we go. I said earlier that all bones and bone markings of the skull you're responsible for. Use the text that's available either on the table or online to get those bone markings. Now please remember, your best bet for knowing which things I put on the lab exam is what? Where do you look? The S drive, which is available to everybody, right? It's on the lab stuff page, and Brianna set it up so that you could get there. So make sure to look at the last 3 years, put all the bone pictures in a separate set of folders, and look those over and ask me questions, because there may not be a key. Please note, some of those tests also have keys associated with them, okay? Models, I think it's said models and keys, something like that, one of the folders. So if somebody had a perfect score, I photocopied their test and then I put it in as the key, okay? All right, so you guys have the skull, right? You guys know what to do for the skull? Please remember, inside and outside. I think it's probably not gonna happen that we're gonna be able to paint skulls as an activity. It's gonna take too long for the skulls to come in. By the time they get in, we're gonna be moving on to muscles, okay? So just make sure you know inside, this is a big one. All the little holes and bumps and stuff, and you guys got an introduction to that in 5, right? So if you haven't finished 5, the skull thing where you're supposed to point out stuff, please finish that today. Please also note that what's being pointed at in the lab is only about half of the bone markings you need to know. It was just an introduction to the bone markings, okay? So inside and the bottom. Make sure that you know foramen's spinosum, ovale, jugular. Those are the main 3 to know, okay? And the styloid process, mastoid process, and the big holes, okay? So there you go, that is the skull. Okay, a couple of other things. Moving downward. So that I don't forget to do this, our next stop is the spinal cord, or the vertebrae. Okay, the reason why I don't like backbone is because it makes it sound like there's one bone. And so, yeah, I probably should have undid this before I started. Okay, while I'm undoing this, I'm going to tell you guys, one of the things that you guys are going to need to know is, I almost got it. Okay. Is to be able to identify the different regions of the vertebrae in addition to the bone markings. Okay, so I'm going to put out a representative, finally got it. I'm going to put out a representative bone from each region, and I'm going to ask you to name it. Now, in addition, I'll be asking you bone markings and the name of the first 2 cervical vertebrae. Does everybody see this vertebrae here? Yep. This is called the atlas, named because the ancient Roman god, I think, Atlas, was depicted as holding the world on his shoulders. You may have seen that. So this bone is atlas because it holds the world of your skull on its shoulders, okay? Please note, one of the main things that you're going to find on a vertebral element is called the body. The body of the atlas is gone. It's been transferred down onto the axis, which is C2. So this is C1, this is C2, but they have names. You will need to know the scientific name for the first 2 cervical vertebrae. Atlas, holding the world on his shoulders, and axis because it allows you what motion? No, it does not allow you to do this. Yes, it's the nodding or turning of your head. Okay? So a couple of things. These foramina here, you need to know as diagnostic for transverse foramina. These are diagnostic for all cervical vertebrae. So when you look at all the cervical vertebrae, you guys are going to see these holes here that allow blood vessels and nerves to go through, okay? This is the only vertebrae in the entire system that doesn't have a body because it's been transferred down onto the axis. So this is called the axis. This structure here is diagnostic, is called the dens or odontoid process, both of which mean tooth-like projection. You can see it looks kind of like a tooth, right? Mm-hmm. So this is the body of the atlas that's been transferred during embryological development and allows the atlas and axis to rotate. And so that's usually the thing that I put on there. Now, here's a key that you should know. the thing that I ask you to identify is usually the diagnostic character for that vertebrae or vertebral group. Does that make sense? So, for example, if I ask for a transverse foramen, then you should say, oh, that means it's cervical, because that's diagnostic for cervical vertebrae. Does that make sense? Okay. Now moving on to regular cervical vertebrae. Non-named. You do not need to know the number, but I'm going to show you a couple of things. Remember, the transverse foramina are here. This is still kind of connected, so I'll try to find one. Here we go. Do you see the transverse foramina there, the little holes? Okay. Another thing that's diagnostic for cervical is what is called a bifid spinous process. Now, spinous process are where the muscles of your neck attach to the bones, and in the neck region, they're bifid, which means they're split. Okay. The only place where they have a bifid or split spinous process. You guys got it? The other thing that's kind of diagnostic is a very small body and a triangular hole. Now what you're going to see as we move down the vertebrae, the hole gets smaller, but the body gets bigger because the body is holding up the weight of everything above it. But as you move further down, the hole gets smaller because the nerves are branching away and there's less inside left that hasn't already branched away into the body. Does that make sense? Mm-hmm. So the body gets bigger, the foramina in the center gets smaller. Okay, so that's cervical vertebrae. Let's go to thoracic. I'm just going to pick a random thoracic vertebrae. Okay, do you guys see the spinous process here? It is what is called inferiorly deflected spinous process. It looks like a knife, but it's pointing downward, inferiorly. It's the only place that it's like that. Okay? The other thing that's very diagnostic is these little indentations on the side. This one doesn't show it as well. Okay, you can't see it as well in these plastic ones, but there are these little dents here where your ribs attach. And that is why it is called a thoracic vertebrae, is because there's a rib that starts here, touches here, and then swings around to the front, forming your rib cage, right? So when you see these little indentations, these plastic ones aren't as good. The real bones that we're going to get out of that cabinet show it better. There are little places where your ribs attach, okay? So the two diagnostic characters are inferiorly deflected spinous process, not bifid, singular. There's no transverse foramina, right? And these are what are called rib facets. Rib facets is where the rib would normally attach and swing around towards the front. You guys got thoracic? Okay. What's the last region? Anybody know?
Lumbar.
Lumbar. Let's pick the last lumbar because it's the most lumbar-y lumbar. What do you guys notice that's different about it? A really huge body because it's holding the entire weight of the body up. Your body is being held by the body. So a very large body. Notice also the spinous process is shaped more like a spoon and less like a downward pointed knife. You guys see that's what's called spatulate. Spatulate spinous process, and it's like a spoon. Everybody see it? Okay. So the key is there's no transverse foramina, there's no rib facets. It's just a kind of a spoon-shaped spinous process, and the key is much larger body and much smaller hole here because most of the nerves have already branched out to the body by the time it gets to your lower back. Does that make sense? So I'm going to ask you, what region of the spinal cord is this from? And I don't need the exact number, but you need to be able to say lumbar, okay? What are the only two that you need to have by name? C1 and C2. C1 and C2, which are? Atlas and axis. Everybody got vertebrae. Okay, there you go. All right, so we were at skull, clavicle. You guys have already started to do this, which is sternal end here and acromial end here. Okay, sternal end is flat. I guess I could get it out so you can see it. Oh, this one has a clavicle. It's in the back.
Oh, no. I thought I saw it for a second.
Oh, here we go. All right. Way to be prepared, Mr. Sage. Okay, so here's the key. Sternal end is flat. Sternal end is flat and kind of thick like a hammerhead. So flat on the end and like a hammerhead. Now the acromial end is more like a shovel or like a spoon. Okay, so acromial end is flat and curved, whereas the sternal end is flat the other direction, like it's sitting on top of something, and much thicker like a hammerhead. Okay, those are the only two structures I'm going to ask on the clavicle. Okay, scapula. Okay, you guys have already started doing this, so you guys already know a lot of these. You guys know what this one is called?
Spine.
Spine of the scapula.
Or deltoid.
Spine of the scapula.
Okay.
Just go with spine of the scapula. Okay, how about here?
Acromion.
Acromion, right? Acromion. And this little C-shaped thing on the, did you guys have to do that on the lab? I don't think you did. Remember that? It looks like the letter C, so it's the C, coracoid process, okay? Coracoid. All right, how about this indentation on the top? That was so 2 days ago, wasn't it? Supraspinous fossa. You guys remember supraspinous fossa? The little indentation on top where muscles are? So if this was supraspinous, what's underneath the spine?
Infraspinous.
Infraspinous fossa. And then if you go below the scapula, what kind of a vehicle goes below the water? Submarine. So this is the subscapular because it's below the scapula. So it's the subscapular fossa. Okay? Last thing that I usually test on is here, glenoid cavity. It's just a little flat surface. The cavity is formed from the connection of ligaments and tendons, but this is called the glenoid cavity, it's flat surface. Okay? I think that's it for the scapula. So moving downward. Shall we do the arm? Yes. Okay. What is this?
Humerus.
Humerus. Okay, let's start up at the top. What's this one here?
Head.
The head, the area just below the head.
Neck.
The neck. Okay, the big bump on top. You guys remember this one? Big bump on top. Greater tubercle. Greater tubercle. Okay, on the hip it's a trochanter. On the arm it's a tubercle.
Oh.
Right? So what would be a smaller, lower one?
Lesser.
The lesser tubercle. Okay? And that's it for this top area. Now, at the bottom, let's start with the front. This curved surface here looks kind of like the dome you would see at the Capitol building, right? At the Capitol, most of the Capitol buildings have a dome, right? You guys know what I'm talking about, the dome at the Capitol? So, thinking Capitol, you guys remember the name of this curved?
Capitulum?
Capitulum, good. Capitulum, cap means head, so it's like a curve like the top of your head. Capitulum. Okay, this curved thing starts with the letter T. Anybody remember it? The trochlea. The trochlea, okay? So how about the big knob on the side? Anybody remember that one? Medial. Anybody got it? Medial epicondyle. Good. So the big thing. So when you feel it, if you feel the inside of your elbow, feel it right now. You guys feel the inside of your elbow. Mm-hmm. You feel that knob kind of sticking out on the medial surface? Mm-hmm. That is this knob right here sticking out. Okay? Medial epicondyle. And then the lateral one is on the other side. You don't feel it as well. Okay? Now, how about here on the back?
Cranium.
Olecranon fossa, because your olecranon of your ulna fits in there, and that's how you lock your elbow. Okay? Mm-hmm. When the olecranon of your ulna fits in there, it locks. So this is called the olecranon fossa. And then here on the front, the little tiny hole. Anybody remember that from Monday? Coronoid fossa, right? Coronoid fossa. And was there anything else? I don't think I'm going to ask anything else on this. That is the humerus. Okay. Let's go to the
radius or ulna?
Yeah, radius and ulna. Where are they? Here we go. Radius and ulna.
Yeah. So I think that's another group.
Tied up. Okay, so this one has a whole bunch of markings on it, but anybody know which one this is?
The head. Okay,
so the key is the capitulum. You see where my finger is? The capitulum rotates right here. So remember I said on the quiz today, it allows you to do this. So what was the bone that rotates attached to your thumb? The radius. So this is the radius. So the head of the radius has a dent in it so that it can articulate with the capitulum of the humerus and allow you to rotate your hand across like that, right? That's how you know it's the radius, this little head with an indentation. The other key thing is it has this large area here that is down by your wrist with the styloid process sticking out. Okay, so here's the, I don't know if I ask anything on this, but styloid process here, okay? I don't remember if I ask number 29 here, which I believe is, I can't remember the name off the top of my head.
Radial tuberosity.
Radial tuberosity, very good, radial tuberosity. Okay, so ulna. Ulna is different because it gets really small at the wrist, but really big at the elbow. So if the humerus has a trochlea on the end, what do you call the name of the notch that fits into that it fits into? Trochlear notch. So that's this indentation right here, the trochlear notch. Okay? And if this fits into the olecranon fossa, what is this? The end of it that represents your bony elbow. This fits into the olecranon fossa, so it is the olecranon, right? The fossa is named for the part that fits into it, so you guys can connect those, all right? And then the little thing that fits into the coracoid fossa, or coronoid fossa, excuse me? Coronoid process. Now please note, there's a coronoid process on your ulna and a coronoid process on your mandible. So you're going to need that 2 times, I guess, if I put it once on the mandible and once on the ulna, okay? And then we also have one more styloid process here, and then we have the head, okay? Head and styloid process. Whenever you see something sticking up, by the way, does anybody know why they call it the styloid process? Anybody know what the name of a pointy thing is that you used to use to
Stylus.
touch? The stylus. It's also the name of the needle that goes down on the LP vinyl, right? It's called the stylus. So if it's pointy, like on the bottom of the skull, styloid process, right? So if it's pointy, it's often called the styloid process because that's like a stylus, okay? If that helps. All right, so down to the hand. Here's the hand. Here we go, hand. Okay, the hand, you guys, I've pretty much already gone through this with you. Some lovers try positions that they can't handle, right? Make sure that you know the bones of the carpal bones. Has anybody looked through the S drive yet and seen what is my favorite carpal on the test? Starts with the letter S. Some. Anybody know it? Some lovers. Why am I blinking? Anyway, my mind's not all here today. I usually ask it right here. It's shaped like the letter S. Why am I blanking? Anybody know the S bone of the cut? Scaphoid. Yeah, I wanted to say scaphoid, but it didn't sound right. Yeah, scaphoid. I like it because the bone is shaped like the letter S, and it's a really cool letter to have as your first name. Or the beginning of your last name. Beginning of your last name, S for sage. Okay, so make sure that you know these. Here's another hint. This is called the pisiform, this little bone that's sitting on top of the hamate. I'm sorry, on top of the triquetrum. The hamate is over here. The way that I always remember the pisiform is, do you guys know what Pisces is? What is the symbol for Pisces?
Fish.
Or pes if you speak, pescado if you speak Spanish. So I always remembered it as the little fish swimming over the coral. So it just looks like a little fish kind of cruising over the top of another bone. So what's it called again? Pisiform, like the fish bone. So remember, this is the fish bone, okay? So you guys need to know these. How about palm bones? Metacarpals, fingers?
Phalanges.
Okay, one of the things you need to know about hands and feet that I did not give you for the quiz is the numbering, so pay attention. Everybody stick your thumb up and say Roman numeral 1. Roman numeral 2. Roman numeral 3. 4 and 5, okay? So 1, thumb, 2, 3, 4, 5. Roman numerals. So thumb would be like the letter I. Everybody get it?
Yes.
So if I ask for this bone right here, the tip of your thumb, that would be distal phalange, Roman numeral 1. Everybody got it? Okay. Where's the middle phalange, Roman numeral 1?
On the other four.
There doesn't have one because you only have 2 bones of your thumb and your big toe. Everybody get it? So if I put a mark on this, you can't just say phalange. This one is your middle phalange, counting from the thumb. 3. I. You guys need to be able to write it in Roman numerals, okay? So 3 would be 3 letter I's. You guys need to figure that out, right? 1 is I, 2 is I, 3 is triple I, and then 4 is IV, and then your pinky would be V for 5. It's weird, but that's the way it's done, and you guys need to know it, okay? You guys got the hand? All right. So we're moving our way down. We did the vertebrae, right? So now it's time for the os coxa. Did everybody get the thing that I put up on the board on pelvis, pelvic girdle, os coxa, and the bones of the os coxa, right? So if I have the whole pelvis, remember it was 2 os coxa, sacrum and coccyx, that is your, no. That is your pelvis or bony pelvis. If you include the sacrum and coccyx along with 2 os coxa, that is your pelvis. Everybody get it? That was on the board. Okay? If you include 2 os coxa and your sacrum and coccyx, that's your pelvis. Just 2 os coxa. You guys see how they come together in the front? That's your pubis, okay? 2 of these, side by side, are what is called the pelvic girdle. Okay, this is the pelvic girdle if it's just these 2. Now, if you look at my old lab exams, that answer never comes up. Why?
Because you don't ask it.
Because I don't sit 2 of them side by side and say, what is this called? Okay, it would either be a whole pelvis with all the bones or an os coxa. Okay? Now, please note, if I say, what is the name of this structure? It is called the os coxa. If I want the name of the bones, there's 3 bones here. Okay? You guys have already started getting into that, right? With lab 5. Okay, everybody put your hand on your hip and say, ilium.
Ilium.
Put your hand on your butt. Ischium.
Ischium.
Put your hand up front.
Pubis.
Pubis. One more time. Hand on your hip. What is it?
Ilium.
Ilium. Hand on your butt.
Ischium.
Ischium. Hand up front. Pubis. Everybody got it? It gets really tricky when this is sitting flat because it's not going to be on a skeleton. Now, the skeleton will be sitting somewhere during the test, but it won't be available at every station. Does that make sense? So you need to know this. And here's the tough part, the part that is going to be challenging for you guys. But because everybody here is doing, well, most people are doing really well, and you guys aced this last quiz, you will see on my old lab exams, I'm going to ask, is this the right or left? Okay, and you guys can figure this out, and I'm going to show you how to do it. Okay? I've shown some people already, but here we go. To determine right or left, you need to orient in all 3 planes. Superior, inferior, lateral, medial, anterior, posterior. Everybody got that? So any bone that is in the appendicular skeleton that's large, I may ask you left, right. Look at my old lab exams. I asked the same ones over and over again. For example, I asked tibia but not fibula, and you'll see why. I ask humerus, I ask femur, I ask os coxa. I don't usually ask hand, but let's go through the bone markings and then I'll show you guys how to remember how to get left and right. Okay? The line across the top. Did you guys do that one already? What is it? Anybody remember it? Iliac crest. Iliac crest. Okay? How about this notch here? Has anybody gotten this one? It is named for a nerve that runs through here that has problems for a lot of people.
Sciatic.
Sciatic notch. This big one here is called the sciatic notch. Okay? How about this indentation here? It looks like a bowl.
Acetabulum.
Acetabulum. If you can't remember how to say it, then just say it out loud a few times. Acetabulum. Why was it named that? Well, that's Latin for vinegar bowl. And apparently there's a story in the Bible about Jesus and a vinegar bowl. So this thing reminded early anatomists of the vinegar bowl in the Bible. So it's called acetabulum. Acetic, as in acetic acid. Vinegar, yeah. And bulum is Latin for bowl. So vinegar bowl, acetabulum. This is where your femur fits in. Okay? You guys got it? All right. This big hole here on the side, obturator foramen. Okay? And another thing that wasn't on your list of things to find, this is your ischium because you're sitting on it, right? Ischial tuberosity, this big bumpy thing, is called a tuberosity. Ischial tuberosity. And then I think there was one other thing. There was a spine. What was this one here? This is the iliac spine. Should be the iliac spine because it's on the iliac bone.
Yeah.
Now, do you guys want to know where they all come together? Well, it turns out they all intersect right here in the center of the acetabulum, and you'll see that in your text. They all join right in the center of the acetabulum. So each bone meets up right in the center of the acetabulum. Okay? Now, on to left versus right. So remember I told you you guys needed to be able to orient superior, inferior, medial, lateral, anterior, posterior. So iliac is where? Because you put your hand up top, right? And what are you sitting on?
Ischium.
Your ischium. So we know this is up and this is down. Ilium up, ischium down. Okay? Now, does your leg come in from the middle of your body or from the side?
Lateral.
From the lateral side or from the inside? Does your leg attach in the middle of you or on the side of you? On the side. So the hole is going to be on the side, right? So we know this is lateral. We know this is superior. Now the question is, what about front and back? Well, do you guys remember the name of this bone? We went ilium, sitting on ischium, and what was up front?
Pubis.
Pubis, as in pubic, right? So this is front. You guys all know that pubic is in the front, right? And the ischium is on the bottom, and the iliac is on the top, because you put your hand there, right? So we know that this is front, this is bottom, this is top, this is lateral. So it must be the right. Now, if you pick up a bone and you turn it around, it's not that hard if you know what you're doing, right? On the lab exam, it's going to be sitting there and you can't touch any of the bones. So it's going to be like CSI. You're going to have to figure it out just from saying, okay, I know that's the pubis, that's in front. I know that this is the acetabulum, which is lateral. I know this is the iliac crest, which is on top. So if I do that, that means it's right. And I see people on the lab exam doing that all the time. And if you got to, you got to. But what can you not do to this on the test?
Touch it.
You can't touch it. And it's the hardest thing in the world because you just want to grab it and turn it around. But if there's clay and pins on it, what will happen to the clay and pins if you touch it? It'll fall off, and then everyone after you will be really ticked off. Okay? You can't touch. So you guys going to be able to do that for left and right? Because you're going to need to. All right. So that is the os coxa. Moving down. Femur. Here we go. Do we have a clean femur? We do. All right, here we go. Femur. Starting at the top. What is this one?
Head.
The head. Sometimes I ask this little indentation. It's got the same name as the indentation on the back of your eye called the fovea. There's a little indentation. It's called the fovea. In your eye, it's called your fovea centralis. It's where you see color. Okay? How about the area right under the head?
Neck.
Your neck. Okay, good. Now, these are bumps that are similar to the bumps that we saw on the humerus, right? Mm-hmm. So it'd be greater and lesser because this one's bigger and higher, and this one's lower and smaller. So remember what I said the name of this big hook-like structure is? If it's not a tubercle, it's a
Trochanter.
trochanter. Greater trochanter, lesser trochanter. You guys got it? Okay. These are the epicondyles. I'm sorry, the condyles. The condyles. These are the condyles. These are articular surface. Normally would be covered with hyaline cartilage. The condyles. Now, how do you know which one is medial and which one is lateral?
The side.
The side with the head is always medial because remember, it's always going in towards your body. So the side with the head is medial. So this is your medial epicondyle, your lateral epicondyle. This is where muscles attach. These are your condyles, okay? Right here on the front, this little V-shaped thing right here is the patellar surface, which means this is the front of it, right? So it can't be in the back, okay? And what about this here? You guys remember that from Monday? Intercondylar fossa. Okay, notice the big divot is on the back. The smaller divot is on the front. You're going to see the same thing in the upper arm bone, okay? So if there's a big U-shaped divot, that's posterior. A small groove, that's anterior. You know this is medial because it always comes in towards the hip. And we know that this is where your hip is and this is where your knee is. So we've got up, down, medial, lateral, anterior. And remember, this is posterior, this V, this U shape. Mm-hmm. So this has to be where? Right. Okay, do you see how I did that? Up, down, medial, lateral, front, back, and you can get it without touching it. All right? Do you guys need to see the patella? You guys know the patella, right? Mm-hmm. What's the question I asked for the patella, if you've looked? What makes this bone so unusual, and what does make the patella so unusual?
Develops after birth.
It's the only bone that develops after birth. I ask it every year, so you need to know it. Okay, it's the only bone that develops after birth. What makes it so unique? Okay, so moving down to the tibia. So it's the tibia and fibula, right?
Mm-hmm. Fibula.
So it doesn't have the same ending? The two lower leg bones don't have the same ending? No, I went over that on my previous tour, right? It's tibia, fibula. So here's your tibia, okay? I remember it because the top of it looks like a T-bone in the T-bone steak, and it looks kind of like the letter T, and it's tops in terms of size. So T for tibia, T-bone, okay? So these are the condylar surfaces. These are the condyles. So we have condyle. It's the only place in the body where you have condyle to condyle. Usually it's condyle to fossa, okay? But this is the only place in the body where you have condyles meeting condyles, okay? So we have condyles here and we have condyles here. And the question is, how do we know medial from lateral on the tibia?
Stivewood process?
Anybody know the name of this hook at the bottom? Yeah, you guys were just going through the motions. This is called the medial malleolus. It looks kind of like a hammer, mallet, malleolus. So if this is the medial malleolus, do I have to put this on the medial side? Or can I turn it around and put it on the, do I have to put it on the medial side? Or can I put it on the lateral side?
It has to be on medial.
It always has to be medial. So if this is medial and this is front, this is your right tibia. You guys see how I'm getting this? Medial, this is your knee, so we know the top. And we know that this thing up here, this bump, is called the tibial tuberosity. Remember the tuberosity on your butt? It was called the ischial tuberosity. It means a large bumpy process to which muscles attach. Your gluteal muscles attach down here, and this is where your quadriceps, all the muscles of your upper leg, attach right here through your patella. Okay? Tibial tuberosity, I like to ask it because I get not only the name of the marking, but the name of the bone as well, right? Tibial tuberosity. Okay? One of the things that wasn't in your lab 5 are these two little points on the top. So these are called the condyles, right? So we have medial condyle, lateral condyle. We know this is medial because it's on the side with the medial malleolus, right? So if there's a thing in between it, this would be called intercondylar, because inter means between. So because it's rising up to emanate or eminence, your eminence is a high-level church person, right? So this is called the intercondylar eminence. Intercondylar eminence, and it almost looks like a crown or a, pope or hat or whatever. Intercondylar eminence, okay? This is where your cruciate ligaments attach that allow your knee to bend. Have you guys heard of cruciate ligament and how people blow them out? My dad blew out his cruciate ligament in college playing football. Okay? This is where your cruciate ligaments attach. So it's called your intercondylar eminence. Tibial tuberosity, medial malleolus. That's pretty much all I asked for the tibia. Okay, next is, I guess I'll just use this fibula here. Okay, the fibula. We have, again, styloid process here. The head, just like we saw in the radius, correct? It's very similar to the radius, except it doesn't move the same way. Okay, so this is the other side of your ankle. So if this is the medial malleolus that represents your medial ankle, can you guys reach down and feel your ankle bone, the swelling of your ankle?
Mm-hmm.
That's your medial malleolus. So your fibula sits right here. Do you guys see how that forms kind of like almost like devil horns or like a W shape?
Yes.
So if this is your medial malleolus and this is on the side, what would you call this marking here?
Lateral malleolus.
Lateral malleolus, okay? Please note, this on a real bone looks more like a spoon or shovel, and this one looks more like a hammerhead with a point sticking up, okay? Like the head of a hammer with a point. So head, styloid process, and lateral malleolus. You guys got it?
Mm-hmm.
Okay. And then we're to the foot, right? And we're done. Okay, the foot, same as the hand, right? One of the key things I ask all the time is calcaneus. This is your heel. I almost always ask it, calcaneus. And then here, the bone that articulates with your tibia and fibula is called your talus because it touches your tibia. The talus touches the tibia and it's on top. Everybody got it? The talus touches the tibia and it's on top. T. Okay? Calcaneus is your heel, and then the rest of them you guys need to know. Does anybody know the phrase for the tarsals? Anybody remember that one?
Metatarsals for the arch?
Well, we're not there yet, but I was just wondering, remember some lovers try positions that they can't handle? I don't remember what the phrase for remembering this. You just need to know it. Guys, there's going to be at least one tarsal bone. I guarantee it. So you need to study them, okay? And the foot will be in normal anatomical position. The hand may be either anterior or posterior view. You need to know the hand both directions. The foot will be in anatomical position. So you need to know the bones of the tarsals. Now, how do you remember tarsals versus carpals? Because your tarsals go with your toes. Tarsals with toes. Okay. The arch of your foot is your metatarsals. And so, what would this one be if it's with your big toe? Metatarsal number 1, and it would be written as the letter capital I. So this would be metatarsal 1, and the same with metacarpal 1, right here. Mm-hmm. Metacarpal 2, metacarpal 3, Roman numerals. Okay, so phalanges and metacarpals, phalanges and metatarsals have the Roman numerals. So big toe is 1. Remember, there's only two bones of the big toe, and the rest have 3. Right? You guys are going to give me the exact same names for the bones of your toes, right? Distal, middle, proximal, phalange, number, count from the big toe. 1, 2, 3, 4, 5. You guys got it?
Mm-hmm.
Okay. That is the skeleton. And, oh, wait, I almost forgot. This is something we went over, but I want to make sure, and let's just do it over here. You guys remember the 3 bones of the sternum? Manubrium, body, xiphoid. Okay, manubrium, body, xiphoid. Am I forgetting anything? I guess that's it. That's the lab exam. That's it.